You seem to be.
Right. I'm going to just hop off and see if I can come right back on, if that's okay.
That would be great. We're going to do something else first anyway. So yeah, that'll
Okay.
work. And I just need to, hey, good afternoon, everybody. And I'm glad to have Kerry here with me. And we have some special guests that I'm going to introduce in a little while and keep you in suspense until then. And I'm trying to, there's my share. Okay. Your screen sharing. Oh, that's interesting. Okay. Now let me share the right screen. Everybody was seeing my emails probably. Okay. Anyway, hope everybody has had a healthy and good weekend, and you're already getting an advanced shot of our guests, but we'll introduce them in a few minutes. First, and really appreciate it because they came on with relatively short notice. We would have them anytime, but we thought this week would be great, given coming off the COVID surge a little bit. It'd be a great week on this topic, so I really appreciate that. And again, Kerry and I will introduce them shortly. Hope all you guys are doing great. COVID-19, unfortunately, it grew again, but it grew several thousand less than the week before when we looked at the numbers. And these are 7 days versus 8 days. I'm sorry, sometimes I'm inconsistent. It depends on which day, weekend day. Usually I look at the data. So, but we try to keep it to a week. And so, but the previous 2 weeks have been pretty significant. And then in terms of deaths, this is good news, though sad, obviously, again, for the people that are dying, but it's fewer than the previous week, which tells us that people are surviving. More people are surviving after they get COVID. And you have to remember, we're just coming out of a significant surge, but it's still tough numbers, right? And if you assume many of these people would not have died, that we realize some may have other comorbidities, cancer or whatever, and could have been in tough shape. But, a lot of the people, even in tough shape, might have lived for another year, maybe 3 years, so it's tough what we're going through, no mistake about it. In the United States, again, the number of viruses grew less than the previous week. It was up about 1 million. The previous week, it had been up even higher the week before that. So it's 700,000. And the deaths are up about 20,000. And again, I mean, it's amazing. Rhode Island is still up there in the top group for per capita. So we're lucky. We're not in worse shape than we are per capita, really. Not lucky. We've been doing a lot of the right things, right? Testing and surveillance, and people maybe are wearing more masks. And then the Dakotas are right up there again, Utah, and then Arizona. So it's amazing. So that's where you don't want to travel, by the way. In our community, we're looking at numbers again starting to go down. It's still significant. And we shared last week that 25% of people in homes in the community combined actually recovered, which means a quarter of our population in the community had the virus over the past 2 surges. And, it's staggering. It's not surprising in a way, right? We don't know how many people don't get tested that have the virus, right? That are part of that 40%, what do you call it, that don't have symptoms, asymptomatic, right? So I wouldn't freak out about the 25% number, but I would, because we had, thank goodness, an aggressive testing program. It tells you if you look at the numbers. But of course, as I shared with you last week, the facilities had even higher recovery numbers, and one of them over 50%, one of them over 30%. So hopefully we're coming out of it. We're really excited. The vaccine's getting to our community. The policy seems to evolve over time. So again, 239 cases, 291 last week, less than 5 deaths reported. And I have to reach out through somebody and just get a total up through now, probably through Liz or Cindy Miller, just to get a up-to-date total, because it's got to be all in over 200 by now, but I don't want to say that because I could be very wrong about that number. But I just said it, sorry. I just probably gave out a wrong number. So forget what I just said, but we know it's over 100. We just don't know because the way that's being reported each week. So anyway, and the good news, again, the vaccine is really penetrating. We're seeing evolving policy last week. We shared last week that we would be sharing information with you, and obviously the DESI program, autism kids program, certain IFS program, and I'm missing one. There was 4, right? Medically complex, maybe is the 4th one.
Yeah.
Yeah, people were authorized, and the unpaid caregivers were authorized. So that was an exciting step, and we're hoping we have a campaign going on. And if you go to thearcofmass.org or arcofmass.org, you can go to the Action Center and write to the governor and say, please, increase prioritization. And my feeling is, as the vaccine numbers go up that we get in this state, that I bet you will see more evolving policy, because the administration has been doing that consistently all along. So, and I think if you write the email to the governor, I think that'll help too. So we're excited. These are the issues that we're working on. I'm not going to I want to really get to our guests. So you can see I didn't edit this slide, huh? So the new announcement came. That's what I was just referencing. So here we are. Okay. And really, actually, I feel like I've known all 3 of these individuals a long time. And really pleased. I know I gave Liz a promotion the last time I introduced her. Liz Sandblom is the Assistant Commissioner Deputy Assistant Commissioner. Woo, I just did it again.
Did it again.
Deputy Assistant Commissioner of Operations at the Department of Development Services. Sorry, Tim. And then we're pleased to have Gail Gillespie, who's the Regional Director for Metro Region. Again, somebody else, my God, I've known for a few years. She started in this field when she was really young, 16 years old or something. And then Colleen Mulligan also, who worked in the same area I worked before I came to the Arc of Mass. And she was really young then for sure too. And she's now Community Systems Director in the Southeast region. And this is just all coincidence, because Kerry did the invitees, I think, with Liz and Gail, I think, right? That's how it progressed. So really pleased to have you with us. Thank you for making your time together. Kerry's helped me facilitate, but we really, this has been something for a few months, right? And more than a few months, that as we've been having interaction with DDS, including the commissioner, and it's just a great opportunity to talk with family, staff, individuals with disabilities about the role of service coordination, review the past year. You see the questions. Kerry, I'm going to hand you the ball to talk about, to share the questions. I know Gail and Liz and Colleen have seen them, but do you want to take the floor?
Yeah, well, thank you. So thank you, Liz and Gail and Colleen. Really appreciate you taking the time to be here. It's almost been a year. Can we believe it? In the early warning, it was a year, but March was really the big shutdown date. So I was hoping that maybe one of you could really kind of talk about the past year. It's been challenging. I know for DDS, it's been challenging for everybody. The state of Massachusetts, the country. And so maybe a little bit about lessons learned, over the past year, what was really impactful. But I'm hoping that you can really talk with people on the call today about what is it around the DDS service coordinator? What is exactly their role? What should they be expecting during this time? What about connections, their role of monitoring, their role of providing, referrals to services and that sort of thing. And even if you wanted to break it out into residential, day, family support, and then maybe talk a little bit about some of the issues that you're seeing in the area offices and across the state. And the last point is really, if families have feeling or individuals have unresolved issues really needing attention, how do they move forward? So anyways, and you're on camera now, Liz, so you're good. So anyways, I don't know who would like to start out, but again, thanks for joining us, and we'll have questions after this discussion.
Sure. So I'll just do a little sort of introduction, and then we can talk about others' experiences, because I'm sure Gail and Colleen can relay more direct information. But I just, I was working in the area office up until the end of June. So I did experience that first surge in an area office. And, that first quarter, I think March, April, and May were really challenging for all of us, right? We've never had a pandemic before. The DDS workers in general never worked remotely before. You know, we were very much routinely in the office and available to, you know, anyone to be able to call and access. We didn't have all the equipment we needed. So the good news is, I think, you know, fairly quickly, we were able to get the field in a position to have, you know, at a minimum, state-issued phones, cell phones. Some of the laptops and that equipment is, you know, rolled out a little bit slower, but we're really on good track to get everyone what they need in that regard. And then I think through the summer, we had a lot of opportunities like this, sponsored events from the ARC, family members getting together and asking us to join in meetings where we really did hear some honest feedback about communication. So we developed a couple of frequently asked question sheets about what to expect from a service coordinator. We also developed a one-page document about what to expect for young adults transitioning from school to adult services during this time period and why it was different and what it might look like. The other thing, because Commissioner Ryder felt it is so important for us to have better and easier communication directly with families, we have been able to hire a part-time consultant to work with the agency to help us develop better systems to communicate directly with families. So he's a social media and communication consultant. So he came on board, I think a week ago, maybe it's been 2 weeks now. So we're excited to see what kind of different ideas he may bring, maybe set up a constant contact type thing so that when Commissioner Ryder has updates to provide, people can sign up for some kind of a list and get emails directly. So we're excited about that. And I just want to highlight that as the last year has gone on, I think we've continued to listen to feedback from families and been able to kind of advocate for some changes based on that feedback.
Well, maybe I could talk a little bit about residential. If you want to talk about day, Colleen, I don't know, is that okay with you? So we continue to refer people to residential programs. So we are, you know, filling vacancies and working with, we have actually even developed a few homes during this year. It's been challenging, but we've been able to do that. And we are in touch with our residential providers very frequently. Most of the area directors and assistant area directors are meeting virtually with their main providers weekly or bi-weekly. So they're almost in more frequent touch with them than they were pre-pandemic. We also started up, I'd say maybe 4 or 5 months ago, in-person outside visits with service coordinators. And you'd understand that it's difficult when the weather gets cold and snowy, but we've really tried to continue to do some of those even in inclement weather. And service coordinators check in with the residential programs more frequently, at least monthly, but usually more frequently. Usually it's once every couple of weeks. And they also try to touch base with the individuals in the homes if they can use a phone and want to talk with the service coordinator. So we are continuing to do sort of work as usual in those ways. We're not in the homes yet. There are we've made a few exceptions around very special circumstances to have service coordinators go into a group home. Typically, they probably would be more likely to talk with someone who lives more or less on their own versus a group home. And we have worked with our QE department around virtual survey and certification visits. Those visits are still virtual, so even our survey and certification teams aren't going into the homes yet. But they are prepared to start when we are able to do that. So I think that's pretty much our oversight of residential. Colleen might want to talk about day.
Yeah, Gail, this is Carrie. Can can you tell us what QE is?
I'm sorry, quality enhancement.
Okay.
It's the oversight arm of the Department of Developmental Services that certifies all of our residential and our day programs.
Terrific, thank you. And then I did get the impression then when you were talking about residential, you were also talking about individuals who may live independently.
That's right.
Who need more, who receive some support from DDS, but not a 24/7 model.
That's right. And service coordinators are checking in individually with all of those folks as well. And then the other residential model that we have is shared living. We're also touching base with providers of shared living supports.
Awesome. Thank you. And then Liz, you mentioned the frequently asked questions. Is that on the DDS website that individuals can go access? I know you sent me one and I'll be happy to share it.
I do believe it is on the DDS website. I think it is, without going in and checking myself, I think we have a COVID tab. So I would suggest if you want to see that would be a good starting place. And if not, I will send you the link, Carrie, after the meeting, and we can, and you can forward it along.
Maybe I should also mention one thing that the Northeast is doing and our region might be starting is they are using an application called Navigating Life. And it is it's a phone application that helps staff in group homes communicate with families and show them what's going on in the group home. It's also an application that some of our service coordinators are using to do virtual site visits. So more to come on that, but that is something we might be adopting in DDS.
So Carrie, I'm not sure that was the link, just so you know, that looked like mass.gov COVID information that you just pulled up.
Okay, yeah, so I'll get, yeah, after the webinar, people will receive the link, so we'll be good. Thank you.
Yeah, now if I find it in the meantime, I'll put it in the chat, Carrie. Yeah, I
Okay.
got one that showed the wrong one. You're right.
Well, with day programs, I think we've had a little bit more of a challenge. As all of you know, when the government shut down in mid-March, our day programs all closed. And they did not start reopening until the summer. And that was pretty much based on each day program's ability to do that. They were down to a 25%. And transportation was pretty limited as only 2 or 3 people could be in a van at a time. So that was a really large challenge for a lot of folks who I think by that point had really wanted to return to their day programs for a little bit of that restarting of their routine. There was a lot of work done by the provider community and the department around maybe some alternatives to what we currently consider our day site-based programs. There was a lot of conversation around some unique types of perspectives, whether it was individual support, whether it was folks doing community-based day supports in the community as opposed to using a site. So there were several work that has been going on and is continuing to go on regarding that also. I think at this point, we have had programs started to open, then they started to close again with the advent of the surge. From what I saw from a transportation update this morning, they're starting to open back up again, so that is encouraging. We have found that a number of our folks have not returned back, whether primarily these are folks who are medically challenged, and folks are just very concerned about them staying safe in their current residential, whether that's living with a family or living in a group home. So we have that piece, and then the other piece is just getting folks there, because as I mentioned before, transportation has been a huge challenge when the vans have gone from 10 in a van or 12 in a van down to 2 and 3. So that has been a problem. So we're continuing to work on that, and service coordinators are in touch with these programs just as they are with their residential. There just really is so much fewer there. Many of our group homes are providing that level of day support in the group home. So that's sort of kind of the update we have there. I did want to also comment that the one thing that service coordinators are continuing to do, or they're continuing to do ISPs, whether that be virtual through a WebEx or Zoom or similar kind of platform, or whether that be verbally. Initially, it started more on a phone call-ish type of way, conference calling. But as Liz mentioned, since the computers have been rolled out for our service coordination team, they have been doing many of those. So that has, I think, helped keep at least goals on track as best as we can, given the current level of services.
Thank you, Colleen. I'm just wondering if you could talk a little bit about day habilitation. You know, I know technically, you know, that is a mass health program, but so many people who qualify for DDS attend day hab. I just thought maybe you could touch upon that a little bit.
Certainly from the area office that I had worked in prior to October, our day habs were primarily opened. We're starting to open also in the summer, just like the DDS programs. They were under the same confinements with the percentage of folks that they could bring in. And again, that depended on how big their site was. They developed safety and PPE and all the other kinds of things that our programs also developed in order to open for mass health. So I think it was pretty similar to what we saw in the DDS day programs.
And I can just talk briefly. DDS and Mass Health continue to meet at least weekly. We're invited to a weekly update that Mass Health provides to all of their day hab provider agencies. And as Colleen said, they are still struggling with reopening fully, and they're allowing different sites to pause services depending on if there might be a cluster or an environmental concern of some sort. So we get that update on a weekly basis for all of the Mass Health Day programs, but that includes day habilitation services. So very similar, I think, challenges that DDS day programs are experiencing.
We find too that a number of families are more reluctant to send their loved ones back to the day hab programs versus our programs, just because of the vulnerabilities of the individuals that are served. And we've tried to do some creative things with family support and with some of the funding that might be attached to someone with the day hab, a supplemental wrap to really give some relief to those families, either, you know, through paying a relative to kind of take them out or provide supervision while the family has a break, or to get them some sort of activity that's meaningful to them so they're not home all the time.
I was wondering about people you know that don't have access to video or, you know, the virtual aspect, the families, individuals at home, and I'm sure your service coordinators have been intervening in some of those. Are there some trends you see there with people at home who don't get to a day program or day hab, who also don't like in Lawrence, one of the agencies told me they had a 0.1% kind of thing of attendance virtual for the day. You know, is there something, I guess they'd be all different kinds of examples, but what do you think from a situation like that? What have you guys heard and tried to do for people in those situations?
I think with folks who live at home with their families and they are able to utilize an iPad or a tablet, family support centers, which have kind of been the superstars for us, in addition to, of course, the residential and DAG, but they have been working with families to set that up and to help them purchase those kinds of technology. I think what we have found, at least in some cases, is that folks have a very limited attention span, and families may or may not have the ability to sit with them during some virtual kinds of groups. So we have sort of been trying to problem solve around that, but that's been a little challenging also. But yes, the technology for virtual and remote or virtual types of day hab as well as DDS services has been challenging and not as frequent as we would have liked.
Some agencies are actually doing some, I won't call it in-home services, but they may have take a couple people out, usually individually with a couple of staff. I know Work Inc. has been doing some of that work. That you're not able to provide 30 hours of activity, but they are able to do a few hours a week with some of the funding resources and the staffing that they have. So agencies are really making every attempt to sort of get somebody out of the house too, if they've been in the house for a long time.
Is it harder for like a service, I guess service coordinator would try to get some resources to them, like you were saying earlier, maybe Liz said that, you know, or maybe Colleen said about the STARS or the Family Support Centers trying to get them resources. Is that like the main strategy a service coordinator would have for someone, you know, homebound and an agency that might not be able to get to them, or a day program not quite there yet in terms of community visit or, you know, like you said, in-home type of modified visit?
If everybody's comfortable with it, not everybody's comfortable with people in their home or taking people out, but we try to do something that will give you know, someone something to look forward to and relief to the family.
Thanks.
And I think that really engagement, you know, obviously can be defined in different ways, but there's an expectation for day habs to check in at least weekly with families during this period of time. So, and it may even be more. But that's been really hard for families too. So, you know, if you're getting a lot of calls, you're getting a call from a service coordinator and a day hab, and you're answering the same questions over and over again, that, you know, I understand as a family member that can get taxing. And so, you know, that's really a personal choice. And if you feel like it's too much, you certainly can say that, but they really are expected. So, you know, we're just trying, I think, DDS and Mass Health to send the message we're here if you need us, and trying to sort of engage as much as possible and be able to kind of hear if there's additional resources that could be useful or helpful that we could suggest going into the home. But I think to Gail's point, you know, some families have chosen to, you know, eliminate anyone coming in the home, personal care attendants, individual outreach workers, you know, because they're not comfortable with that. And, you know, we respect those individual decisions.
There's a couple of chat items. Carrie, you want to go there, or do you have a question you'd like to ask?
You know, just yeah, I should have put on that list when I did this morning. Of course, there's going to be lots of questions around the vaccines because you know, definitely that's a key to getting people back to some sort of normal. But anyways, I don't know if you just wanted to give an update on that before we go into the questions.
Well, you know, we of course follow the governor's guidelines for vaccine, and right now we're still in phase 1, which you probably all know includes our staff in group homes. And it also will include our healthcare workers and individuals who are over 75. So that's really the folks that are getting vaccinated right now. The governor will let us know when phase 2 starts, and phase 2 will include people over 65 and then also open it up to people with comorbid conditions, which many of the folks that we serve have. So we anticipate that many of them will receive that vaccine in phase 2 if they have those conditions. I saw in the chat asking when day hab folks will be vaccinated. We know nothing more than what is in what are in the phases that the governor has dictated. So right now we're not having anybody in day programs vaccinated. That's just, they're not part of the phase 1 rollout.
But the attestation if for comorbid, oh, go ahead, Liz, go ahead.
No, I just wanted to kind of reinforce what Gail said. So I'm part of the home-based healthcare workers and the 4 small groups of essential caregivers that Leo had talked about earlier on. And the individuals that we support, the individuals eligible for DDS services, aren't anticipated to be sort of their own group called out separately. So it's really important. I always encourage families, and I know this isn't always the answer, but to go on to that website and to look at the most up-to-date information. Sometimes it changes. It surprises us sometimes when it changes. So there is a lot of advocacy out there. I just want people to know that. But at this point in time, individuals that we support, other than people who are living in congregate care settings, are not, are not listed as a separate group. They're part of the age and the comorbidity kind of groupings.
And I just want to, since you mentioned about advocacy, I just want to tell people it's internal advocacy going on as well as the external that I discussed earlier. And we sent letters, by the way, from the beginning with both ourselves and then with Center for Public Representation and other groups. I think there was 20 groups on a letter a few months ago about this topic. So I just want to encourage people to go on the Action Center and, again, our homepage and send it, because I think policy has evolved, even the one, that just happened, right, about those small groups, the unpaid caregivers. So I think it can happen. And I'm not even sure if some day staff were able to get vaccinated because of part-time being in the homes and things like that. I almost feel like people get scared to lose a vaccine, right? If people don't show up, having backup people.
Well, just Leo, day staff is part of the phase 1.
It is, okay.
Yeah. Yeah.
So they were incorporated. Okay, that's what, okay, great. So that to be clear. So if we can get the comorbid thing is, I would, if I'm a family member or an individual with disability, I would say, hey, I have X disability, that's one condition. And then I have, seizure disorder, or I have X. And if you get to a test, if they don't go strictly by the CDC webpage. So that's the big question. So you would need to check at that point if phase 2 kicks in. But hopefully you won't have to check, because hopefully Science just published an article that my colleague sent to me this morning, Bruce Bird, about prioritizing our population. That's in Science. And then there was another article that Patty sent to us, who's probably on the call, which just shows the continued bias in the healthcare field. So it's really important to break through this and get the vaccinations going for our population. So Carrie, it's a question from Alice about getting into the house. And I'm sort of surprised it's been 11 months for you, Alice, because I thought there was a thaw. Oh no, you could only get into that's right, it was restricted, right, where you could get to, okay. So basically about the whole issue of, as guardian and someone who wants to see how her son's doing and how the situation is in his room and, the whole picture, right, of his living, she can't check in, and others can't check in. And what do you guys think is going to change that, or when will that change?
I think it's been really difficult. The restrictions have been really difficult on family members. I just have to recognize that. It's been, and they do sort of vary from agency to agency, because we really rely on our providers to make the decisions about what's safe in their home. So you will find inconsistencies, I think, from home to home. In most homes, Alice, don't allow guardian or family members to go into the individual's bedroom. That's true from my perspective. In our state ops, we usually have a visit, if we are allowing visits in the home. If there's nobody who is COVID positive in the home, we try to do it in more common areas, and we don't typically have folks go into the bedroom. I know that varies from agency to agency. When will that happen? I don't know. I mean, people are asking a lot of questions about, once we're vaccinated, will the restrictions lift? And will we have to use the PPE? There are tons of questions that relate to that. And I don't think we know the answers to them yet. And I think we have to really rely on the infection control experts to advise us around some of the lifting of some of the restrictions.
I just want to say I'm working with Commonwealth Medicine on infection control, and we've had some discussions about what are the next steps. And I think right now the focus is so much on getting the vaccine out there. But those discussions have started to happen. Like Gail said, what does that mean for visitation? What does it mean for PPE? When can people go out to dinner and go bowling and do the things that are important to them, following the vaccine. So as we're coming up, a lot of people are coming up on, second rounds. Some agencies are still doing, group homes are still doing first rounds, but it is something that we're asking Commonwealth Medicine to work with, the CDC, and really kind of keep their ears and eyes open, because that really, the CDC is what's driving all of that infection control related policy at this point.
So one other thing related to that, I guess the question from Alice is, if people aren't in the home, could there be a strategy where a visit to the bedroom could be made, to make sure everything's in order, to make sure if there's supplies needed. I know that's unusual, but it would maybe require a staff person, obviously, to still be in the home. So that's one suggestion, which you can answer in a minute. And the second thing, well, it's a different topic. Let me just have you answer that one first. There was something else I was going to ask you related to that, but I'll let it go. Go ahead. So if someone wasn't in the home, right? If the persons aren't home, and could a guardian visit then? Could there be some consideration of a policy around that, just to check in and see how things look?
Sort of going to depend on the agency, but we have done things like taking pictures of the bedroom. There was
That's a great idea. Okay.
Yeah, there was a mom that, just wanted to see the new bedspread she bought for her son. So we took pictures of the bedroom, and we have done a couple of virtual with the phone, throughout the house. We've done that too. So we're trying to accommodate. It doesn't really give you a real sense of what it's like every day, but it will give you, a glimmer.
That's better than nothing. I like the video idea too. So that's remains to be seen. By the way, Gail referenced state ops. Instead of asking her what that means, there are homes that are state operated. It's about 1,000 people served through that system. And there's about 7,700 people served through private providers, most of them nonprofit providers in the community. So that's our community system. So we often use shorthand to avoid long sentences. So the other question from Linda relates to people that don't fall into those 4 groups that got tagged in terms of caregivers, unpaid caregivers. And so, even though there's a medically complex program, right? Not all people who have individuals, complex medical conditions have their sons and daughters or brothers or sisters in that program. Mm-hmm. So could there be a way to figure out, through the area office system, maybe, who those people are and get them incorporated into the 4 subgroups?
So at this point, I think that, we have to continue to follow that those 4 subgroups are the groups that have been approved for vaccines. I know that's frustrating information to hear, but there was a lot of advocacy to get that far, and they're very targeted, specific program enrollments. I've had questions about people who had recently been enrolled and have aged out, or but it's currently enrolled people in those 4 programs at this point. Again, my group meets 3 times a week, and there's a lot of advocacy. It's not just DDS, it's DCF and DPH and DMH and all the sister agencies, and we continue to have a lot of advocacy around this.
Linda, I have a suggestion for you, Linda. You might want to talk to some colleagues about, is there a workable way you could identify people with the help of the area office, and then we could forward a recommendation it's very specific, that we can share internally, but also externally, as well, to advocate for. Because you guys are trying to do it. Sometimes it's sort of up to us too, to think of, is there a discreet way to do it? That's why you were able to achieve, what you did achieve. It was a smaller subgroup, it was identifiable, right? And there was a limit to the number.
But I just also need to say that, one of the biggest challenges right now is supply in Massachusetts of the vaccine. So we have to keep that into consideration as well. Even if we opened it up to more groups right now, people are really struggling, or the places where you can access vaccine are not good matches with the individuals and the high level of need that they have, like the mass vaccine sites at Gillette or Fenway or things like that. That seems to be where there's access right now. So I anticipate over the next couple of weeks, I think this week is even already better than the last 2 weeks, that things are going to start moving and rolling a little bit more smoothly. So I'm hoping with that, we will get that next group, which is the 2 comorbidities, and many of the people that we're talking about right now are going to have access to that.
Great.
Great.
Okay.
I'm just,
Anything else,
wondering if
Chris?
there's been other discussions about a disability itself being a comorbidity. I know that was talked about on the federal level. I'm just wondering, in Massachusetts, if that's been considered.
So there's a list of comorbidities on the website, but every time there's a list on the website, what I'm being told is this is not an exhausted list. And so I'm just going to
Okay.
leave that there.
Okay. All right. Good to know. Thank you.
I know
Are you
Down
talking-
syndrome is counted. If somebody is diagnosed with Down syndrome, I believe that that is considered for sure a comorbidity. But
And are you talking about the CDC website, Liz, just to be clear? Or
no,
are you
I'm talking about the mass.gov website.
Yes, the one I was on, the wrong one I was on earlier, that might
Yes.
have. Okay, all right, good. Maybe I'll put that up too, but I did find the right one with the FAQs, though. Actually, you actually have a link there for families and individual at
Oh,
that
see?
page.
Good.
So, and you've had it for months, by the way. I remember using it to see if we had all the resources you guys had. Carrie, go ahead if you want to.
Okay. Just wondering, any other questions? Seems like we've kind of cleared those. Anybody else have anything to ask? I'm really looking forward to the next 12 months to see that, moving forward and what are some of the lessons we have learned and how do we apply them for future program and support for people with disabilities and their families. So it would be really terrific to have almost kind of a summit or a group or a town meeting just about lessons learned, later on in the spring when hopefully things are somewhat coming back to normalcy and people are getting more vaccinated. So it'd be interesting to see how we can take some of those silver linings that have happened and be able to apply them. But I want to, looks like time is up. And so I want to thank our guests today, Gail Gillespie and Colleen Mulligan and Liz Sandblom, all from DDS, for taking the time out of your busy schedules and being with us today. So thanks.
Nice to be with you all.
Everyone.
Thank
you.
you all.
Thank you. Take
Thank you,
care.
guys.
you.
Take care.
Thank you.
Bye-bye.
Bye.
Bye-bye.